The third heart sound is an extra sound that occurs in early diastole just after the second sound. It is low-pitched and requires the bell of the stethoscope to be held lightly at the cardiac apex. Listen to a third heart sound. I will begin with 3 normal beats and then add the third heart sound. This sound may occur as a normal physiologic variant in children or adults under the age of 40. When a third heart sound occurs in patients over the age of 40, heart failure should be suspected. Patients with an audible third heart sound usually have a decreased ejection fraction. In fact, a third heart sound may be the earliest clue to heart failure. This sound occurs in patients with heart failure whose causes include dilated cardiomyopathy, ischemic heart disease, or valvular heart disease. Since the third heart sound is normally faint, it is heard best at the cardiac apex with the patient in the left lateral position. This position brings the heart closer to the chest wall and improves the chance of hearing a faint third heart sound. A third heart sound can also occur in volume overload states, such as mitral regurgitation or ventricular septal defect. In these patients, the third heart sound does not necessarily signify ventricular failure. The third heart sound is felt to originate in the ventricular wall. It can be increased in loudness by having the patient perform mild exercise such as a few sit-ups. In some patients, a third heart sound can be palpated at the cardiac apex with the patient in the left lateral position. When a third heart sound is added to a normal first and second heart sound, a triple rhythm is created. This triple rhythm is called a gallop because it mimics the sound of a horse galloping. In the case of a third heart sound, this is called a ventricular gallop. In summary, a third heart sound is a low-pitched, early diastolic sound heard best at the cardiac apex using the bell of the stethoscope with the patient in the left lateral position. Although it can be a normal finding in younger patients, in those over the age of 40, this sound usually indicates heart failure. Listen once again to a patient with a third heart sound.